Our heart contains a specialized cells and nodes controlled by sympathetic and parasympathetic nervous system. These nodes are 1. SA node, which considered the natural pacemaker of the heart because it has the highest degree of automaticity, producing the fastest intrinsic heart rate. 2. AV node, which performs the following four essential functions to support cardiac conduction. 1. The AV node delays the conduction impulse from the atria to provide time for the ventricles to fill during diastole. 2. The AV node controls the number of impulses that are transmitted from the atria to the ventricles. This prevents rapid irregular atrial heart rhythms from destabilizing the ventricular rhythm. 3. The AV node acts as a backup pacemaker if the faster SA node fails. When an impulse from the SA node arrives at the AV node, AV nodal tissue becomes depolarized and the AV nodal pacemaker timing is reset. This prevents the AV node from initiating its own pacemaker impulse that would compete with the SA node. 4. The AV node can conduct backward impulses through the node. If the SA and AV pacemaker cells fail to fire, an electrical impulse may be initiated in the ventricles and conducted backward via the AV node. 3. Bundle of His. Electrical impulses are conducted in the ventricles through the fascicles of the bundle of His, which arises from the AV node. The conduction fascicles run through the subendocardium, down the right side of the interventricular septum to the left and right bundle branches. The right bundle branch and the two divisions of the left bundle branch eventually divide into the Purkinje fibers, which have the fastest conduction velocity of all heart tissue. Purkinje fibers divide many times, terminating in the subendocardial surface of both ventricles. The first step of cardiac conduction is impulse generation. The sinoatrial SA node contracts, generating nerve impulses that travel throughout the heart wall. This causes both atria to contract. When the impulses from the SA node reach the AV node, they are delayed for about 1/10 of a second. This delay allows atria to contract and empty their contents into the ventricles prior to ventricle contraction. The impulses are then sent down the atrioventricular bundle of His. This bundle of fibers branches off into two bundles and the impulses are carried down the center of the heart to the left and right ventricles. At the base of the heart, the atrioventricular bundles start to divide further into Purkinje fibers. When the impulses reach these fibers, they trigger the muscle fibers in the ventricles to contract. The right ventricle sends blood to the lungs via the pulmonary artery. The left ventricle pumps blood to the aorta. The electrocardiogram is a graphical representation of the electrical activity across the heart. It is comprised of a series of waves that represent depolarization and troughs that represent repolarization. There is a lag between the depolarization of the myocardiocytes and the actual contraction of the muscles. As a result, the waves of the ECG will precede the waves of the pressure curves, which are caused by actual contraction of the heart muscle. The P wave, which represents atrial depolarization, precedes the A wave of the atrial pressure graph. The QRS complex represents ventricular depolarization, which causes the ventricles to contract. The large wave of the ventricular pressure graph begins shortly after the QRS wave. The T wave of the ECG represents a time of ventricular repolarization and subsequent relaxation. Therefore, this wave starts toward the end of systole. Then the cardiac cycle consisting of P wave, which represent atrial depolarization, contraction, PR interval, which represent the atrial repolarization, relaxation, QRS complex, which represent the ventricular depolarization, and T wave of the ECG represents a time of ventricular repolarization and subsequent relaxation. This complete cycle is called a normal sinus rhythm.